about this. This is a topic that is near and dear to my heart, for sure. So just to give a quick overview, and this is just scratching the surface in terms of looking at some of the disparities that exist in our county. So if we look at things like emergency room visits to hypertension, African Americans' rate per 100,000 is 3 times that of whites. Same thing, if we look at emergency room visits for asthma, African Americans are 3 times that as whites. Diabetes, African Americans' rate per 100,000 population is 2.5 times that of whites. If we look at things like the percent of babies with very low birth weight, African Americans are 2 times that of whites. Infant mortality, African Americans are 3 times that of whites. And so there are so many examples where African Americans in particular, but certainly communities of color, are disproportionately impacted when we look at health outcomes. So some might say, well, racism doesn't determine your health, but I would argue it absolutely does, because where people live, work, and play affects health. So there's a growing body of literature that talks about the impacts of toxic stress. And when we live in an environment that is not safe, where we cannot access healthy food, where we cannot access parks or sports or things that help us to have a strong sense of community and health, we see very poor outcomes in adulthood. So we looked at these factors as well. And again, just scratching the surface, African Americans and Latinx populations in Riverside County live below poverty at 2.5 times those of the white population in Riverside County. The percent of adults aged 18 to 64 without health insurance, the Latinx population has 2.5 times the rate of not having health insurance as do white Riverside County residents. If we look at percent of homeowners versus renters, the white population, 76% own homes and about 20% rent. But if we look at the African American population, 53% own homes and 42% rent. And Latinx population, 58% own versus 37% that rent. So I know that those numbers don't add up exactly to 100%. I'll just make note of the fact that some of them, there were some unknowns in the survey process for that. Just a couple more examples. Whites, 22% of the white population in Riverside County makes less than $30,000 a year, whereas if we look at other racial ethnic minorities, 40% of them make less than $30,000 per year. African Americans are arrested for misdemeanors at twice the rate of whites and 3 times the rate of whites for felonies. And if we look at student suspensions, this data is from 2018 to 2019, African American students are suspended at 3 times the rate of white students in Riverside County. So again, all of these things are just a quick snapshot of things that impact the way people live, work, play, and ultimately impacts their health due to toxic stress and all long-term outcomes from these types of disparities. So with that, I will stop and answer any questions if you have any.
Thank you, Kim, for your report. Supervisor Jeffries, I see your hand raised. Did you have a question?
Yeah, actually I do. And I don't know if it's for Kim or you, the 2 supervisors who sponsored this. It could just be a misperception on my part. I've always, as I've listened to this issue on healthcare and tying it to racism, I've always felt that there was a finger being pointed at the professional healthcare staff in all of our clinics and our hospitals and behavioral, everything across the board. There was a finger being pointed at our staff, and this is a little more personal than it should be. Basically accusing them of indirect or direct participation in racism in our healthcare delivery. And in that scenario, there was no way I could support this, implying that they were participants in that effort. And I'm wondering if the two of you could share with me or Kim that this is not about the way we deliver healthcare. It's about a societal challenge that we all face, and it's not directly the responsibility of those employees. Can you comment on that to alleviate my concern a little bit?
Mr. Chair, would you allow me to try to-
Washington, go ahead.
Thank you. You know, Supervisor Jeffries, I am very happy that you asked that question in the way that you asked, because it is part of the challenge in having, and I referred to it as uncomfortable conversations in our society. When I see people respond to Black Lives Matter with All Lives Matter, the phrase Black Lives Matter was never intended to suggest that only Black Lives Matter. It was to suggest that Black lives also matter. And what happens when you see it as all lives matter is that the person that's saying Black Lives Matter is pointing a finger at you as a non-Black and accusing you of racism. That's not what's happening. That's not what that statement's about, and neither is this resolution. This resolution attempts to acknowledge that the structure of our society has not met the aspirations that have been stated by our founding fathers. That even though we have this aspiration that everyone can be treated equal and have equal access, the reality is, and it's borne out by the data, that they don't. I mean, and our public health director just stated that concern is near and dear to her heart. And I think she's saying that not out of a sense of guilt that she is somehow guilty of not providing. I think she's just acknowledging that that is the environment that many people of color have had to exist in. And so this attempt to acknowledge that via a resolution is not finger pointing. This is not saying to any white person or anyone else that doesn't fall within that category of people of color that somehow you're at fault. It's saying, let's all acknowledge that there is a problem and let's all work together to try to solve that problem. Hopefully that helps.
Thank you, Supervisor Washington. If possible, Kim, are you still on the line?
I am, Supervisor.
Yeah, so if you don't mind, maybe providing us a little bit more context on this resolution. I ask that because I know that throughout the state of California, public health departments, and I think you're part of the association, that have been speaking about this, that obviously racism is a public health, some people would say hazard, other people would say crisis, and in this case we're saying crisis. And so I wanted to ask you kind of a loaded question, open-ended question. How did we get here? Your association, for example, that you're part of, what was that discussion like?
Sure. Thank you, Supervisor. So I think that there is pretty uniform agreement within public health as a discipline nationwide that racism is a public health crisis. And so because public health, and when I say public health, I mean the lowercase public health, right? It impacts us in so many forms of life. And we see the impacts of that on the downstream end with disproportionate health outcomes. And so that is the lens under which public health professionals are really looking at racism, because racism is the upstream effect of those disproportionate health outcomes. We see that systemic racism is in play with housing rules and regulations, education, employment, transportation, criminal justice. And I'm not speaking about Riverside County specifically there. I'm speaking again as a nation. And if we look historically about how laws have been established and how they have been implemented across the country, there's been a setup that people are disproportionately impacted at the result of those types of policies and procedures. And we've seen that with redlining and with different things across the country again. So I think what we're talking about in the public health world is really looking internally to the county, to a city, to a nation really, and looking at everything that we're doing with the lens of equity. So how can we make sure that all of our policies and procedures are developed with a lens of equity and that they're not going to have an unintended consequence for my communities of color, or that they are not going to cause some unintended health outcomes. So I think that part of the challenge that we're seeing as public health professionals are a need to increase understanding and awareness in people, because racism isn't, we're not just talking about overt acts of racism. We're talking about systemic racism, implicit bias, things that people don't even necessarily understand or recognize are continuing this systemic racism that has a negative consequence. So I think public health in general, again, is committed to work towards eliminating systemic racism, because ultimately it's going to lead to a healthier community and we're going to have better health outcomes. And if we have better health outcomes, then we see increased productivity, we see improved economic status, all kinds of downstreams effect. And just the whole piece of where people live, work, and play and their health, they're also interconnected, that we have to address them holistically. And at the root of that is systemic racism.
Thank you, Kim, for being very thorough on this subject. Really appreciate it. I see Supervisor Spiegel's hand raised.
So, Kim, I don't know what part you played on the resolution. My question comes if it talks about going through the policies, it talks about all the different things that we should be doing as a government agency, and no one's questioning that. It's the very end, it talks about supporting the creation of a Riverside County task force and develop initiatives and programs to help fight systematic racism. So I was just curious as to what that thought process was. Is this a community group? Is this one that's more inclusive of, employees and those in the community? I was just trying to get an idea, because that term, we already have that already within the COVID world. So is this another task force focused on racism, on public health, or you even know?
So Supervisor Washington or Perez may have an opinion on this, but I would tell you that in my opinion, I think that this ties in nicely with item 3.1 and the listening sessions, because I think that those listening sessions are really important to helping us develop a roadmap for going forward. And so I think that there are a few ways that it could be done. I think we have to make sure that we have our house in order as a county agency, and that includes training for staff. It includes looking at our policies and procedures, again, with that lens of equity. But I think that we will be most successful if we engage the community. And one of the callers earlier talked about hearing their story. And I think that's really important for us to make sure, for us to be able to make sure that we're making changes to our policies and procedures that are going to address systemic racism. So I think it's really going to be a joint effort going forward. And I think that the listening sessions with the community are a really important part of that.
I couldn't agree with you more. That's why I made a comment that the two go hand in hand. This is, the first item was more of an action. This is kind of a follow-up to it. So that was why I was questioning the task force, because it has to be all parties at the table. It can't be just county going through policies and trying to be better without knowing how can we be better in the eyes of those that are being affected by our behaviors.
Exactly. That's right, Supervisor.
And very quickly, if I could just add, you're absolutely right, Kim, and you're absolutely right, Supervisor Spiegel. It is tying them together. That is for sure. That's how I see this as well, and it complements, from my point of view, it complements the efforts with Supervisor Jeffries and thinking about the task force and thinking about how our departments perhaps potentially could have the need for more training when it comes to bias, for example, or, when we're talking about budgets and how we could better support those budgets when it comes to the social needs in our communities, which ultimately then ties to social disparities. And so that's kind of my mindset on that. And I'm sure Supervisor Washington has his point of view too. His hand is raised, but Supervisor Jeffries, I think, raised his hand before. And as well, mind you, folks, we also have about 6 or 7 individuals on the line. And so Supervisor Jeffries.
I think I'll defer to Supervisor Washington because I was getting concerned that we're going to have 3 different task force. And I think this is why we need our board study session, is to iron out how we're going to utilize task force and what we're going to utilize them for and how many. So I'll defer to Supervisor Washington.
I agree with you 100%, Supervisor Jeffries. And that's one too many task forces, that's for sure. I don't think we need that many. Supervisor Washington?
Well, I also agree with Supervisor Jeffries. We need to sort of condense this, and I really love what Supervisor Spiegel has said. One more sort of an emotional comment, if you will. One of the things, aside from being married to the most incredible woman in the world, that I am mostly proud of is my service in the Navy to this country. I love this country. We are the most diverse country on the face of Earth and the greatest. But we're not tapping into all of our potential. And there's an old saying about a rising tide floats all boats. Some boats aren't rising, aren't being floated up. And so if we are truly to meet that aspiration again, we need to focus on ways to achieve that outcome. I'll leave it at that. Let the speakers express their comments. Thank you, Mr. Chairman.
Thank you, supervisors. Madam Clerk, I think speakers have been waiting for quite some time. Let's go ahead and have them speak.
Yes, sir. Our first speaker is Avalon Edwards, and Avalon will be followed by Antoinette Ratcliffe, who will then be followed by Carrie Then.
Avalon, can you hear me? It's Avalon on the line.
Hello?
Is that you, Avalon Edwards?
Hi. Yes, can you hear me?
Yes, we can hear you.
All right, thank you. Just to reintroduce myself, my name is Avalon Edwards, and I'm a policy fellow at Starting Over. I spoke earlier on item 3.1. I urge our county leadership to vote in favor of item 3.71 on today's agenda. Racism has long been a public health crisis in Riverside County, and the board's official acknowledgement of this fact is significant. This resolution serves as a critical stepping stone towards anti-racist policy and budget reform that can make a real difference in this county. I look forward to seeing how the board commits to actualizing the values laid out in this resolution. And I am grateful that Supervisors Perez and Washington have brought this resolution to the board. And again, I ask the county to vote yes on agenda item 3.71.
Okay, thank you for your testimony, Avalon. I think the next person on the line is Antoinette.
Yes, sir.
Antoinette, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, you have 2 minutes.
Thank you so much. And thank you for giving me this opportunity. I encourage our county leadership to vote in favor of item 3.71 on today's agenda. I encourage you to take advantage of this opportunity to save our future. I say future because I personally first experienced racism before I even fully understood the term in my earliest years of elementary school. I was placed in GATE and accelerated learning classes, and as one of the only Black students, sometimes I often became the target of discipline, quote unquote discipline, for things that couldn't have possibly been problematic in any learning environment, like asking too many questions during class, or like declining to share my notes or my learning supplies with students who teased and taunted me daily because they knew I'd rather deal with it than get in quote unquote trouble for standing up for myself. Because in actuality, anytime there was a dispute in the classroom, I was involved, I was the only student to get in trouble. But I was a straight A student, no behavioral issues or history of, and I was always eager to learn and help my teachers. So I couldn't understand why was I always in trouble. My mom was always being called from work and hated being interrogated for the quote unquote source of this attitude, just to explain that no, I didn't come from a broken home. No, I don't have an absent father, and I don't need a father figure because I already had one. And no, I wasn't being abused at home. It was embarrassing. It was confusing. It was silencing, humiliating, and ultimately damaging. I'd eventually end up in 4th and 5th grade spending excessive amounts of time in the nurse's office for chronic migraines, which my pediatrician said was due to chronic stress. I got in trouble for that too, though. My teachers would assume that I was just wanted to get out of class, when in actuality, I loved class. I still love to learn. I didn't get it. I didn't get it then, but I get it now. It was literally racism. Now I can stand up and say, stop being racist and condescending and limiting my ability to learn and to grow. Then, though, I was silent. I was powerless. I was robbed of my dignity and my pride in learning. So today, at nearly 30 years old, I picked my head up. I found my voice, and I am saying stop. Stop hurting that little girl and all of the voices, little Black girls and boys who are subjugated by racism in our most early stages of development. This resolution will serve as the critical stepping stone towards anti-racist schools and institutions and anti-racist policy and budget reform.
Thank you, Antoinette, for your testimony. Apologize, your 2 minutes are up, but thank you for speaking up and waiting to speak up at least a couple of hours. Madam Clerk.
Yes, sir.
Who else was it?
Our next speaker is Carrie Then, to be followed by Leslie Figueroa.
Carrie, can you hear me?
Yes, hi. Yes, my name is Carrie Fenn, and I live in Moreno Valley in Supervisor District 5. Racism is as contagious as a virus and as difficult to cure. It pervades our county and can be seen in multiple areas of our society. Our prisons are clear examples of how race, but more importantly, skin color, is a determining factor for incarceration. Another area is home ownership, which was mentioned previously. Racism limits the availability of affordable housing, as developers have no cause to build lower income housing even when there is high demand and available land. Racism creates educational hot zones where the most qualified teachers and brightest students transfer out of lower performing school districts to those few in the county that do meet California performance standards and metrics. Racism is a major reason for land use and zoning laws that encourage industries to seek out cities and unincorporated areas willing to allow low-paying part-time jobs to proliferate with very limited upward mobility. Racism perpetuates a prejudicial class system. It draws clear lines of where to buy a home, what jobs are available in our communities, and who gets promoted. Health and wellness are also clear areas, as stated before, where racism increases infant mortality and the death of mothers at birth. It also decreases longevity of both men and women. Racism causes food deserts, digital divides, and toxic environmental hazards in our communities. Racism is a public health crisis, and Riverside County must declare it, so specific actions can be taken to finally address these issues comprehensively. Racism is real, and it is a deadly disease. And I'd also like to comment to thank Supervisor Spiegel for that unagendized item earlier on celebrating the 100th anniversary of the 19th Amendment. Supervisor Spiegel and I served on the former Riverside County Commission for Women, and I appreciate that she actually brought that to the table. Thank you for your time today.
Thank you, Carrie, for your testimony. Madam Clerk, I believe Leslie is next.
Correct.
Leslie, can you hear me?
Yeah, I can. Yeah, I can hear you. Can you hear me?
Yes, you have 2 minutes, Leslie.
Awesome. Well, good afternoon, everyone. My name is Leslie Figueroa, and I'm a policy advocate with Leadership Council for Justice and Accountability in the Eastern Coachella Valley. I did want to take the time to thank Supervisor Perez and Supervisor Washington for the resolution to declare racism and inequity as a public health crisis. I think as we've seen with the COVID-19 pandemic, it's really highlighted the continued systemic racism that exists already in housing, health, employment, the criminal justice system, just to name a few. And it is really promising to read a resolution that looks to prioritize these different types of investments and, promoting equity, addressing social determinants of health, and really looking to identify those solutions of eliminating systemic racism in all the sectors of the county. However, moving forward, I think we do ask the county to meaningfully engage, and I know we've heard a lot of conversation about engagement today, so I'm super excited that that's happening. And I know we see that it's been, it makes sense to include community. So community residents, organizations, I know in the East Valley, we really want to make sure to include residents and include organizations to further continuing that collaborative process. This means engaging with communities who are currently in unsafe housing conditions, at risk of eviction, without access to clean water. And I think this also means making sure that it's outside of just the board meetings, so in like Zoom meetings, figuring out stuff with the radio. I think being super creative around this time is really important, and making sure we can get all that engagement and input for people that might not be attending these board meetings and spend all day listening to them also. So any ways we can figure that out, I think it's possible. So, and also additionally, we ask that there be some institutionalized process to give these report backs on equitable measures and resolutions that is included within this resolution. That way there is this loop that is closed with community. So it's not just a one-time or two-time meeting, but there is this cycle that is closed. And a resolution can be a powerful statement, but it's only a statement if it's no action. So I think it's a disservice to the community if we don't have action, but I'm seeing that there's going to be a lot of action. So looking forward to that and participating in more details of the process that's to come. So we ask the board to vote yes. Thank you
for your testimony, Leslie. Madam Clerk?
Yes, sir. Louis Nolasco, followed by Regina Stell.
Louis, can you hear me? Louis, can you hear me?
No, he's no longer on the call.
Okay, Regina, can you hear me?
Can you hear me?
We can.
Can you hear
now.
me?
Yes, we can.
Great, thank you. Thank you. Good afternoon. Board Chairman, I thank you for this time to each of the supervisors. I take pride, being a community, a Riverside County resident. Thank you today to let me speak. I am representing today as the local branch president for the Riverside NAACP. We have voices across the county, more and more coming in every day. As we reflect today, let me say to you, crisis is an opportunity for change. Racism exists. We are now in the process of getting people to not be silent and to speak. And even myself, I find myself being educated on truly what racism is and what it does and what it has done. But today, this resolution, I believe, or we believe, speaks to taking action to propel critically needed movement at this time in our community. Yes, Riverside County is a community, very diverse, very large. But listen, your voice today to the response to this resolution will speak to this Riverside County community that you at your highest level of leadership is saying, yes, it does exist. Not only does it exist, but we are committed to take change and to make action for our constituencies and our communities throughout this county. This will be a voice to the community of Riverside County that our values are backed by words. And as you know, money, the budget tells it all. It is formed on the values of what people believe. Yes, this resolution will speak to the need for reconciliation, transparency, transformation, inclusivity. We need your leadership today. We know you are leaders. We know our county. We know that our teams at the county departments, the agencies, nonprofits, all of us are willing to do the work. We are willing to do the work for the individuals and families that we love and support here in Riverside County. You are the leaders. You're at the top. Set the bar today. Begin the work. Take a stand for what you know is right. Begin with this resolution, and let's get the work done. We are community partners here with you, ready.
Thank you, Dr. Regina Stell. Your 2 minutes were up. I appreciate your passion, and even though I couldn't see you, I felt it. That's for sure. Madam Clerk?
That was the last speaker for this item.
Thank you. And so any more comments or questions, concerns by my colleagues on this item?
Mr. Chairman, I would make a motion that we approve the resolution, and I'm open to engage in more conversation if my colleagues would like.
Appreciate that. Supervisor Washington, I'd like to second that motion. I don't see anyone else's hand up. And so with that being said, Madam Clerk, please call the roll.
Yes, sir. Supervisor Jeffries?
I don't know if I see him on the line.
Supervisor Jeffries? Supervisor Spiegel?
Yes.
Supervisor Washington?
Yes.
Supervisor Perez?
Aye.
Supervisor Hewitt?
Yes.
Was that
Madam Clerk, before you close the roll, is Supervisor Jeffries on the line?
I am. I'm back. Thank you. Apologize, Mr. Chair. Aye.
Thank you. That motion carries 5-0.
Thank you, supervisors. Thank you, Supervisor Washington, for bringing this forward and for allowing me to co-author with you as you being the lead author on this item. And all of you that gave testimony, that called in, that waited maybe a few hours as we started this meeting at 9:30. It's now 12:38. Thank you as well.
Supervisor Jeffries said earlier about item 3.1, waiting to get it right. I can't tell you how proud I am of my colleagues at this moment, that we are arm in arm and we are moving forward together to address the needs of our county residents. Thank you.
We made history today, folks. So I appreciate that for the benefit of our communities. Thank you, Supervisor Washington, for your leadership.